Good afternoon. I'm Dr. Dustan Clark. I'm the Extension Poultry Health Veterinarian here at the University of Arkansas. I am also the Associate Center Director in charge of the Poultry Extension. I'm here to talk to you today about poultry health and diseases. We're covering a lot of topics with these videos, and this is a very important one. One of the key aspects of this is poultry health status determination. You need to know what is normal, considering that a very simple definition of disease is any departure from the normal state of health. So what is normal? You know, many of the diseases look alike. They produce similar symptoms and signs and lesions. So what do you look for to know when something's wrong? Well, a key part of that is monitoring your birds. That is one of the best things that you can do as far as disease control, is recognizing any problems early. So get out and look at those birds, and we've talked about this in some of the other videos. Walk through the poultry house. Take a look at those birds. See what they're doing. You know, often the very early signs of disease can be detected before it becomes a real problem in there. So, a little bit on recognizing the signs of illness. The thing to remember is that there are many, many poultry diseases, and a lot of them do look very similar. So learn what a normal bird looks like. And then what you're going to check for is any variance from normal. Use a systematic approach. Just like when we were doing the necropsy, using that systematic approach allows you to check everything and not miss something. One of the first places to start is looking at your records. First off, keep good records. You're going to have to decide what is an acceptable parameter. Now, in the poultry industries, usually there are certain percentages, such as say 1 or 2% mortality. There's parameters that we can measure. It has to be something that's a measurable form of data. Look at the past history. I know as a veterinarian, when I go out to a flock to determine illness, I like to check the records, look at what's going on in there, what's their mortality, how many birds, are they seeing any sick birds, what percentage of egg decrease in production do we have a decrease in weight gains, all those things that we can measure. And then I discuss with the grower the past history. You know, has this problem been seen before? You know, if so, when? And then collecting all your current information. Now, one of the places I start is I like to look at the facilities. When I first get on a farm, I just look around and get an assessment of what's going on in the whole farm, looking for signs of outside influence when I go to a poultry house to a farm. For example, do I see signs of outside influence, say from rodents or wildlife? I look at the feed and water sources. You know, do we have wild birds? They're eating the feed. Look at the number and availability of the feeders and waterers. Is it an appropriate number for the number of birds that's in there? Is the feed clean? Is the water clean? I look at the litter or the ground. What are they using for litter? Or is the grower using wood shavings or rice hulls or something else? What does it look like? Get an assessment on it. Is the litter too dry? Is it too wet? And then just look around. If these are breeder birds, do we have roosts? Looking at the manure underneath that, or as I walk through the poultry house, look at the manure. What do the feces look like? Can I find any evidence of, say, blood or something like that in there, or evidence of diarrhea? Then I look at the birds. First off, as I'm looking in the poultry house, I want to get an overall view of the behavior of the entire flock, be they baby chicks or adult birds. You know, for example, with the baby chicks, if we have them in a situation where they're still being brooded, do I have birds underneath the brooder? Do I have birds away from the brooder? Do they look comfortable? But there's the whole flock. What are they doing? And then just kind of pick out some individual birds and look at them. What is their behavior? You know, are they huddling up with other birds? Are they cheeping excessively? Are they eating and drinking? Are they running around in the house? Are they appearing normal? And I've listed here some examples. Again, looking at the eating and the drinking and the interactions of those birds. After I do that, I'm going to have to catch a bird or birds and give them an examination. So I will pick out a bird or two. I like to catch a normal bird, or one that appears normal. One that may be by itself. Usually a bird that's ill is going to stay away from the rest of the birds, and I'll catch one of those. And I'll just examine them. Just give them a physical examination, basically. Here we have a normal bird that you can look at. This bird looks really good. You know, standing on two legs, wings tucked against the body nice and tight, no discharges or anything, bird looks good. When I've caught that bird and I look at it, I am going to systematically check all of the anatomical systems, and I'm looking for variants from normal. So I'll be checking the skeletal system, respiratory system, plumage, circulatory system, such as the heart rate, things like that. What do the eyes look like? The ears, the nostrils, gastrointestinal tract, fecal material. Looking for different things such as a discharge. Are there discharges from the eyes or from the nostrils? Are there any accumulations? Do we have dried discharge outside those nostrils? Is there dried discharge on the wings? Use. Now what I mean by that is, are they capable of using their legs and their wings? I teach my students, if you have to chase a bird all over the house to catch it, there's probably not anything wrong with that bird at all. Look for swellings. Do you see a swelling of the face? Any swellings on the legs or on the wings? Is there soiling of the feathers? Often soiling of the feathers is from diarrhea. Is there loss, as in loss of function? But again, just systematically go through everything. You're going to be able to get an overall idea of the weight loss of that bird or its condition as you're holding it, feeling of those breast muscles. You'll be able to feel the heart beating. Now here's some physiological parameters to use. Remember the temperature of the bird? And a chicken is somewhere around 102 to 107. We like to say average of about 104. That's in degrees Fahrenheit. Heart rate, 200 to 250 beats per minute. Now the smaller the bird, typically the higher it goes. Respiration, 15 to 30 per minute in the chicken. As I mentioned, if you have to chase that bird all over the house and catch it, your respiration is what's going to be accelerated, as well as your heart rate. But you can just get a rough idea of the temperature of the bird by feeling of the bird. Part those feathers, just feel of the skin. They're going to feel warm because again their temperature is about 104. The heart rate, you're going to be able to feel that heart beating as you hold that bird. You'll feel it coming through the muscles, and you'll be able to observe the respiration. One quick thing to look at on the respiration is the bird just sitting there normally breathing through the nostrils, or is it open mouth breathing? If we have open mouth breathing or we hear sounds, then there may be a problem there. Now, here are some signs of disease in avians. This would fit for any avian species. Depression. What we mean by that is the bird is basically just sitting over there by itself, not interacting with anyone else. Maybe a discharge from the nostrils or the eye or the mouth. Diarrhea. Many times this is evidenced by fecal staining of the feathers. Coughing or sneezing. You may not hear the bird's cough. You may be able to see wet areas on the head or the shoulders because they will, in essence, wipe their beak, their nostrils, on their wings. Inability to stand or walk. Loss of feathers. Possibility of thick scabs on or around the leg scales or on unfeathered areas of the body. Of course, no appetite. That you can detect if you feel of the crop of the bird and by looking at the records. Look at the feathers. Do we have loss of feathers or broken feathers or accumulations on them? When you examine that bird, kind of part those feathers. Does it look like there's dandruff there with legs on it running around? That would be indicative of lice. Do we see parasites on the bird or parasites in the feces? Any swelling of the joints? Blisters or scabs on the skin? Swollen foot pads? Any swelling of the face, comb, or the wattles? Do you detect any unusual odors when you get close to the bird? Again, systematic approach. That's the key. As best you can, you want to systematically look at all of these systems in the living bird. Now, with that said, it is a great idea, in my opinion, to have or perform a necropsy on some of the dead birds. If you have mortality, the necropsy, as I demonstrated the other day, can be exceptionally helpful. You're looking at what's going on inside the bird. If you can spare them, it's always good to have a normal bird for comparison. You can pick up many of the early signs of disease, and a lot of this is covered on the video that we made on necropsy. Now, there's some other diagnostic tests that may be needed. As far as diagnostic samples, submitting to a diagnostic lab, for those of you in the commercial industry, usually you'll have some type of service technician who can help you out. They may be the one doing the necropsy for you. If you want to report some problems to them when you see them, as soon as you see something different, get in touch with them. If birds are going to a diagnostic lab, they may request dead birds and maybe a few live birds as well. As far as tissues, some of the things that can be submitted for further testing, blood or serum. Tissues can be things like the trachea or maybe a small section of liver or the lungs, something like that. Swabs, those can go in various types of transport media. Now, commonly here in the United States, we use BHI, brain heart infusion, as a viral transport medium. There are other types of swabs that have Ames transport media, things such as that can be used for bacteria. A swab of the oropharyngeal region, in essence the trachea, or the cloaca. Those can be looked at to see what might be found in there. Blood, you've got to get the blood out of the bird. Now, in my opinion, the two easiest veins to draw a blood sample from, the wing vein and the jugular vein. I personally prefer the jugular vein in the bird on the right side because it's a little bigger. But the wing vein is easy to draw out of as well. You may need some assistance, or you may be the person assisting your service tech to draw that blood. Using a syringe, a small needle, typically 20 gauge or less, and then such a syringe such as a 3 cc syringe. Insert that into the vein and pull back on the plunger, gently drawing that blood out of there. Now, whole blood samples need to be protected from temperature extremes. Heating and or freezing will cause those blood cells to rupture. You want to fill the blood tubes that you're using. Don't fill them completely, only fill them about 3/4 full at the max. Typically, half full is best. 2 to 3 mils of blood is usually sufficient for almost all testing. Allow the blood in the tube to clot. Lay that tube on a slant or on its side and allow it to clot. And it needs to be shipped into a diagnostic lab or taken to a diagnostic lab using some type of cold pack in an insulated container. Now, with the serum and the plasma, you want to allow those to clot completely before those are centrifuged and then send that in. And with the serum, it's only about a half a mil up to a mil for most testing. Bird specimens. Most diagnostic labs prefer to have about 6 to 8 birds per house. If you can't really spare that many, it's a good idea to talk to the people at the diagnostic lab and find out about how many birds they would like. Usually they want some birds that appear slightly sick and some birds that are showing clinical signs, and then some without any signs at all. And the goal on that is to identify as early as possible. Many to obtain microbiological samples that are not contaminated with any secondary infections. Now, it says right here, also want sick and dying birds as well as recently dead birds. That's a good idea. The dead birds, on a necropsy, you can find out what has happened. The sick and the dying will tell you what they have got. And again, they may want a normal bird for comparison. The list here, culls and runts, those should not be submitted because usually those, they don't really usually figure into the equation of what may be going on in there. Now, it's best to perform a necropsy. The absolute best way to perform it is on a recently euthanized bird, such as euthanize the bird, then do the necropsy. So, the diagnostic laboratory may want live birds if possible. You can do a necropsy on a bird that's been dead for about up to 8 hours, provided it has been kept in refrigeration. On a hot summer day, figure that bird is 104 degrees anyway, and when it dies, you're going to have some problems. You can see lots of post-mortem autolysis, and it may not be able to determine what's going on in the bird. Again, here's a nice normal bird. Now, the clinical history. This is important. This is what you're seeing and what's going on. The more information that you can provide the service tech or to the person, the diagnostician in the diagnostic lab, the more information you have on the history and the environment the flock is in, the better chance you're going to have of getting a correct diagnosis. Now, a good history can contain such things as the management practices, such, for example, your ventilation. How often do you ventilate? Your lighting program. It's especially true if these are birds that are for egg production. What type of feeding and watering systems used? What's their feed consumption? And then their performance records. What are they doing? If you have the history on the vaccination, that's always good to include it, such as what the schedule is, the types of vaccine used, and at what age they were vaccinated. Other things, environmental history, you can put in there what the weather was doing when this first started. For example, what the temperature was doing. Where's the farm located? And then any history of any problems in the past, such as how long did the clinical signs last? What was your mortality associated with that problem? What's the morbidity? Now, the mortality is the number of birds dead. The morbidity is the number of birds ill. You know, where and how were the birds found dead? The history of disease should include anything that you as a caretaker of those birds or service technicians can remember about the signs and the progression of the disease. The more history, the better. Now, as far as sample collection and submission, swabs, it really depends on the type of testing. There are different swabs for different tests. For example, there are swabs for bacteriology, those that are used specifically for salmonella, and then the PCR testing, which is polymerase chain reaction. It's a good idea to contact the diagnostic laboratory to find out what type of swab they want. Fecal samples, those need to be kept moist and cool. We don't want those to dry out. We don't want any parasite eggs in there to hatch out. Formalin-fixed tissues. Many times if you have a field technician who's doing a field necropsy, they may collect some tissues for the diagnostic lab. Those tissues, always collect a small amount of tissue from anything that looks odd. A good example would be a small piece of the liver, a small piece of the spleen, maybe a small piece of the lung. These tissues, we're looking for lesions to give us an idea of the immune status and what's going on. Make sure those affected tissues include the lesion with a little bit of normal tissue around that. That's always good for the pathologist when they're looking at that. You want to get your specimens from fresh dead or euthanized birds, because we do have post-mortem autolysis that happens. And those are put in 10% neutral buffered formalin with a ratio of 1 part tissue to 10 parts formalin. I know as a diagnostician, it's very, very frustrating when you get a small tube of tissues where that it appears that they were just stuffed into the tube and then the formalin was poured over it. 10 parts formalin, 1 part tissue. That allows for fixation and preservation of the tissue. Here's an example, demonstration of taking a swab. You want to swab the oral pharyngeal region, which is at the back of the throat, and the cleft palate, right here at the top, which is the choana. May need to do a tracheal swab. Usually that takes a much, much smaller swab, and you'll usually have a specific type that you need to use on that. Again, get that information from the diagnostic lab as to what they would like it to be submitted with. Now, I'm going to cover some poultry diseases. I've tried to pick out some diseases that are seen, some of the more common ones, talking a little bit about the disease, going over some of the signs and lesions, and some things that can be done for it. The thing to remember is this: there are a lot of diseases out there, and many of them look alike. It's always good to have some type of reference material. This is Diseases of Poultry. This is an excellent book. There are many other books out there that are really, really good. The thing to remember is that some diseases are more common than others. Some diseases are reportable. Some of them are treatable. Some of them are preventable. And that prevention can be by vaccination and then biosecurity. Biosecurity is extremely important. We cannot re-emphasize or emphasize how important that is. That will help you in preventing diseases. So I started out here by listing what's called egg-transmitted diseases. Now with these diseases, the causative agent, the pathogen, gains entry into the egg typically before the hen deposits that egg in the nest. The ovary or the oviduct may have the causative agent present there. In other words, the hen is a carrier. She produces an egg that's already infected. Other disease organisms gain entry into the egg as a contaminant from fecal material on the eggshell. One of the diseases that was a problem in the United States in the early days of the poultry industry, in fact, it was one of the reasons for the development of the National Poultry Improvement Plan, was Salmonella pylori, commonly called Pylorum bacillary white diarrhea, or BWD. We still see this disease in some of the small hobby flocks periodically, and it is seen in other countries. In the U.S. commercial industry, it's pretty much a historical disease, but it is an example of an egg-transmitted disease. It is a salmonella that is adapted to poultry. Most of the mortality is in the young chicks less than 2 months of age. Now, it's very rare, again, I'll mention it's very rare in commercial poultry. This has to do because of all the efforts of the National Poultry Improvement Plan. You may have in your area some type of state or province or whatever, some type of organized, regulated program to test for these diseases. Typically, the number of affected young birds is fairly low, but it could be up to almost 100%. The mortality could reach 100%. Now, this was not only spread by egg transmission, it could be spread by infecting the navel and or orally. Signs, fairly general signs when you think about it. Depressed birds, unthrifty, they're going to be chirping, they'll be huddling. You could see this with many diseases, but you would see a white diarrhea and a pasting of the vent. Possibly some respiratory signs. Those could range from being very, very mild to moderate, maybe some blind chicks because it's in the eye, and some lameness. What did we see as far as lesions with this one? Grayish white areas of necrosis in the body organs, such as the liver, the heart, the lungs. May see some cheesy cores in the ceca. Now, the ceca are those two blind sacs off the intestinal tract at the junction of the small and large intestines. They may contain a core of what looks like just a little piece of dried cheese. Of course, the birds would be dehydrated. They would have an enlarged spleen and congested liver. Inflammation around the heart. In older birds, the hen could have what's referred to as blighted ova. The follicle would look sort of grayish white in color. Diagnosis of this one was by isolation of the bacteria and then a blood test, what is called the rapid whole blood agglutination test. And it's one that can be done in the field to look at these birds. Treatment, antibiotics will help the birds, but you've got carriers, so you really don't want that. Primarily what's done with this is to test those birds. Any birds that are positive, get them out of there. Prevention, again, testing of the breeders and removing the positives. Biosecurity, keeping out the possibility of infected birds, and then just periodic testing. Another salmonella, Salmonella Galinarum, the disease referred to as fowl typhoid. It too was another disease that played into, in the United States, the development of the National Poultry Improvement Plan. It was primarily seen in adult birds. It is salmonella. It's also a poultry adapted salmonella, very similar to Pylorium, and it too is a historical disease in the commercial industry primarily. We do occasionally see it in some hobby flocks. But in your country, it may be a problem in some of the birds. Now, it can be seen in chickens and turkeys and game birds. The number of birds that could be affected could be up to 100%. It was an egg-transmitted disease in that the egg was infected at the time the hen produced it, and it was transmitted horizontally from bird to bird. Signs: lack of appetite, unthrifty, depression. Very similar to what we see with Pylorium. Decreased egg production, since these are adult birds. They're going to be sort of ruffled, and they'll have a yellowy diarrhea. But again, if you reading through these symptoms here, these signs, lots of similarity here to what was seen with the previous disease. Lesions, the liver would be enlarged and it'd have sort of a bronzing color. Inflammation of the intestinal tract, referred to as enteritis, and an enlarged spleen and possibly some anemia. Diagnosis, same way as Pylorium. Isolation of the bacteria and the rapid whole blood agglutination test. Treatment, same things, not done routinely because carriers can result. So it's a test and destroy. Prevention, isolate, test those breeders, destroying the positives, and again, biosecurity. Cannot emphasize how important that is. Can't emphasize it too much, I guess is the best way to put that. Salmonella Entertainers. This is another salmonella that is seen in poultry. This one is zoonotic, meaning they can be transmitted to people. They can catch it. The problem was recognized in the late 1980s, about 1988. This disease also came underneath the National Poultry Improvement Plan in the United States. It's becoming more of a problem in people in regard to certain serotypes isolated. Now, it is primarily by a fecal oral transmission into the egg and by egg transmission. The bacteria can be spread from contamination of objects and eggshells getting into those eggs. Usually the mortality in the infected bird is fairly low, but it too can be similar to the other two salmonella in that the signs, diarrhea, unthriftiness, lack of appetite, increased water consumption. The lesions, birds will be dehydrated, and of course weight loss. If they're not eating or drinking, that's commonly going along with it. They're just not going to be in production, inflammation of the intestinal tract and enteritis. You will see the blighted ova, or you can, and then inflammation areas in the heart and the liver, cecal cores, the egg yolk in a baby chick unabsorbed, but there may be no lesions whatsoever. Diagnosis, again, isolation of bacteria and a blood agglutination test. We can also use an ELISA for this one. Treatment, antibiotics based on sensitivity. Now, typically as a veterinarian, when antibiotics are recommended, it's based upon a sensitivity profile. That bacteria is cultured and antibiotics are used against it, tested against those antibiotics to see if it's sensitive or resistant. But again, as with other salmonella, we can have carriers. So treatment really you may just want to consider destroying the birds that are positive. Prevention, there's that good old word again, biosecurity. Of course, good sanitation, again, testing. Rodents do carry this, so good rodent control. There are some vaccines out there for Salmonella Entertainers that can be used, and then competitive exclusion using some of the products to exclude those salmonella from the GI tract, what we call probiotics. Now I'd like to talk to you a little bit about a couple of other bacteria that are also egg transmitted. These are the Mycoplasmas. Now Mycoplasmas are a little different type of bacteria. They lack a cell wall, which is important in antibiotic selection. Many of the antibiotics that we use to treat bacterial infections work because they interfere with the development of the cell wall. Now, these bacteria can be transmitted through the egg or other methods. And we can have more chronic types of infections. First off, talk about Mycoplasma Galinarum, commonly referred to as MG or CRD. CRD stands for chronic respiratory disease. Lots of people will have colorful names for this one. At least in the United States, they call it all kinds of things like the crud and other types of things. Now, this is basically a slow chronic respiratory infection. We can see this in many avian species, in chickens and quail and turkeys. Some of the wild birds can carry it. Typically what happens is that large numbers of birds in a flock can become infected, and they may show a few signs. Some of them may not show anything at all. May just be carriers. Mortality is typically very low with just plain mycoplasma. It does increase though when we have complications from other types of infections along with it. It does set the birds up for some secondary bacterial infections, such as an E. coli infection, and I will be talking about E. coli. The birds can become infected by inhalation of the organism, or it can be an oral transmission. They can get it in their eye. Fomites are very important with this one, and fomites are like your shoes, your clothing, your hair. So one of the reasons when we do biosecurity, when we go into a farm, we put on a hairnet, things like that. Now, the infected birds shed the bacteria in the exudates from the nostrils and the eye, also by egg transmission. Incubation typically pretty short, about a week. Young birds are typically much more severely affected than adult birds. Outside of the bird, the organism is a fairly short-lived organism. Sunlight helps kill it, dry it out. Organic matter does protect it a little longer. Carrier birds usually shed the organism when they're stressed. Now, this bacteria can be carried on your clothing, it can be carried on supplies. That's why it's important that we use coveralls and things like that for biosecurity. So what do we see? May not see anything at all. You know, a lot of these birds have no lesions whatsoever and have no signs. Maybe a slight cough. Usually there's some degree of performance effect, and it's a little poorer than normal. Here we have a picture of a bird right up here in the corner. You can see there's a little bit of foam right there at the corner of the eye. You can see there's some swelling of the face right there. It will slow the growth down of birds and slow down their weight gain. They're just not going to want to eat. Lesions, swollen face and sinuses, as we see like in this bird right here. They can be stunted, maybe some leg problems, poor feathering. May see some lesions of exudate inside the bird, especially if we have a secondary infection, such as we can get with E. coli. Those lesions will be on the heart and liver. There'll be an increase in mucus in the respiratory tissues due to inflammation. Many times in these sinuses, it will be a very thick, clear mucus. And you can see that if you push on the face right in this area, right there, that thick mucus will come out of the nostril on that side. In the air sacs, on a necropsy, the air sacs that talk about these little thin membranous structures right here, they may have this foam on them, so they look a little foamy. And we can get some infection in the oviduct and in the tendons. So this bird here, you can see there's a little bit of foam at the corner of the eye. There's the swelling of the sinuses, the face, and here we have some of that air saculitis. Diagnosis, signs and lesions gives you a pretty good idea, and then the isolation of the bacteria using some specialized medias. There are serologic tests for this one. I've mentioned 3 here: an ELISA test, which is enzyme-linked immunosorbents assay, an agglutination test, a hemagglutination inhibition test, a lot of PCR tests. These are really excellent tests, the PCRs, and that's the polymerase chain reaction. You want to differentiate this disease from other diseases, such as Mycoplasma Synovia, IMS, and coryza. Treatment, again, antibiotic sensitivity. Although many antibiotics help, there's that problem with carriers. One of the best things you can do to treat it is to give the bird some comfort, reduce the stress, keep down the dust, keep down secondary infections. This, as an egg-transmitted disease, is another one of the diseases that you do not want to get. This is where the good management of the birds, the breeder stock, to make sure that they're kept clean by testing is done. Prevention, again, test and destroy, destroying any positives. All in, all out has really helped with this. And what we mean by that term is that all the birds go into the farm at one time and they all leave the farm at the same time. Of course, no other flocks on the premise is good. In other words, do not keep a backyard hobby flock on the premise. If they come down with this, then it could spread to the commercial birds. Monitoring, periodic monitoring of those birds. Now in the United States, it's part of the National Poultry Improvement Plan, and then testing those positives and destroying them. There are vaccines that are available in some countries that can be used. And then again, that good old word there, biosecurity. All those things that you can do to keep diseases out of there. Now here's some pictures of some birds. Now you can see these are basically non-commercial type birds. Here we have a chicken. You can see evidence here on the beak, some dried exudate, and there's a little bit of foam right here at the corner of the eye. That tells me that this bird has got some nasal discharge. It's just dried. Here we've got a bird, obviously this bird's not feeling well. Eyes are held shut. Here we've got a little bit of facial swelling. This bird over here, closed eyes. As we see in all 3 of these, there's a little bit of swelling there. Usually in a bird like this, if you put a little bit of pressure right in that region between the eye and the nostril, you'll see some of that exudate come out of the nostril. Now I'll talk a little bit about Mycoplasma Synovia. It's commonly referred to as MS. Now it is another mycoplasmal disease. It can be very similar to MG. It has variable mortality and morbidity. You can have a low mortality and a high morbidity, or vice versa on that sometimes. It too can be complicated by secondary bacterial infections, which one of the most common secondary bacterial infections would be E. coli. It's transmitted very similar to MG. It can be egg transmitted through respiratory droplets. It can be transmitted by fomites, such as your clothing. The spread can be very slow or it can be rapid. The incubation period is about 2 to 3 weeks. Now, as with the MG organism, it too does not survive very long outside of the bird. Stress and other infections do complicate this one. What are the signs? Very similar to what we saw with some of the MG. No signs at all in some of these birds. They're just carriers. Ruffled, feathers, they're unthrifty, just not feeling good, maybe a slight cough. Lameness can be variable. This one does get into the foot pad and the hock, cause some swelling there. And as you can see these lesions right over here, there's a swollen foot pad here, a little bit of swelling of the hock. Production loss. Similar problem we saw with MG. This can be an egg production loss that can be very slight up to significant. Poor growth, unthrifty birds, just not wanting to grow. Lesion, the exudate is going to be in the joint, the foot pad, the tendon sheath. Typically this exudate is sort of a thick gray color to a yellow. We have swelling of the liver, the spleen, swelling in the kidneys as well. It too causes that air saculitis, like see right here. And this can have exudate on it, which can be mucoid or even up to a cheesy exudate. Some birds you may see a slight green discoloration of the liver. Diagnosis, of course, signs and lesions gives you a pretty good idea. Isolation of the organism using specialized medias. But depending upon those serologic tests and those newer tests such as the polymerase chain reaction, the PCR test and the enzyme-linked immunosorbents assay, which is one that's done on serum. PCR is done on a swab, such as a tracheal swab or oropharyngeal swab, or a swab of the affected tissue as you'd see here. All good tests to detect it. Treatment, similar to MG, this organism does not have that cell wall, so our choice of antibiotics is limited, but our biggest problem with antibiotic usage is we can reduce the signs and the lesions just like we can in MG, but we have carriers and we don't want that. Prevention, good old biosecurity, all in, all out production. Again, test and slaughter. And many, if not most, of the companies are doing this. Testing those birds, destroying the positives, making sure to keep it cleaned up. Again, no home flocks. You don't want to have commercial birds in a small flock of your own chickens. Prevent wild birds getting into your commercial birds and exposing them. Vaccination. Now this can be used in some countries. Every country has its own regulations, and many states and provinces may have regulations as to what vaccinations can be used as well. So there are vaccines out there for both MG and MS, but it has to be checked into. Usually what's done is try and keep this controlled in those breeder birds so that we don't have birds being produced that are infected with it. And that's in the broilers. Now in the table egg chickens, the same thing. Since table egg chickens are kept on a premises much longer, we may have at least some increased risk. Anytime you have birds that are staying around a longer period of time, there's increased risk of them coming down with a disease. Now I'll talk about the non-egg transmitted poultry diseases. These are diseases that the birds just pick up, the chickens. They're not transmitted in the egg. The Salmonella Entertainers and Galinarum and the Mycoplasma Galinarum and Synovia, those can not only be picked up from other infected birds such as through fomites or respiratory oral or something like that, or inhaled, they can be egg transmitted. These diseases that I'll talk about now are the ones that are not transmitted through the egg. Infectious bursal disease. It's a worldwide disease that affects young chickens. The disease is commonly referred to as gumboro, or IBD. It is caused by a burnavirus, and there are two serotypes, type 1 and type 2. Type 1 is the one that causes clinical disease. The virus is shed in the feces, and it's a fairly stable virus outside of the bird. Two types of infections. We can have a clinical infection, clinical disease, or subclinical. With subclinical infections, typically those birds are less than 3 weeks of age. So we figure that as a cutoff period, 3 weeks or less. There are some strains that can affect birds a little older than that, say this 3 to 6 week period, and be a subclinical infection as well. In those older birds, that immunosuppression is usually transient. But the biggest problem with this disease as subclinical is immunosuppression. We reduce the effectiveness of the immune system. The disease does that. Maybe no clinical signs whatsoever in those birds. But what happens is the B and T lymphocytes, which are in the bursa fabricius, the thymus, which has the T, and some of those both in the spleen, they just are not there. They're immunosuppressed. Clinical infections. Now with clinical infections, the incubation period is a short period of time, 3 or 4 days. You may see birds pecking at their vent, watery diarrhea, maybe just a little blood back there on the vent. A lot of times that's from the picking, a lot of times it may just be a discharge, and some soiling of the feathers from the diarrhea. Lesions, hallmark lesion, the bursa fabricius, which is that lymphoid organ located above what we call dorsal to the cloaca, is swollen. And it'll have hemorrhages on it, maybe a yellowish discoloration, It may be atrophied. Sometimes there is a caseous, a core of inflammation inside the bursa. Diagnosis, we can use PCR test, which is polymerase chain reaction, histopathology to look at those tissues microscopically, and then clinical signs and lesions can give you a real good idea, especially if you have birds that have that swollen bursa. Serologic testing and virus isolation. There is no treatment for this one. Basically what I call TLC, tender love and care, making sure those birds are kept comfortable, taken care of. How do we control it? Well, vaccination of the breeder flocks. The goal is to vaccinate those breeder birds with many of the vaccines that we use in the breeder birds, so that we want the females to produce eggs that have those antibodies in the egg. Now we can also vaccinate the chicks, and the vaccine is available for use even in the egg, what's called in ovo vaccination. That's vaccinating in the egg. And then again, biosecurity, keeping the disease out. Marek's disease. Marek's disease is also a viral disease. It's a highly contagious disease, and it too is seen worldwide in chickens. It is caused by an alpha herpes virus. Now this virus can survive in the environment for months, and I've got a slide later on depicting. With infectious organisms, there's a variable time as to how long they can survive under ideal conditions in the environment. This one's transmitted by body secretions. The virus is found in the body secretions, and it's found in the feather dander. What are the signs? Well, there are three manifestations of this disease. It can be neurological, it can be visceral, or cutaneous. In other words, in the nerves, in the organs, in the skin. And here we have a chicken, a broiler, that you can see is affected. This bird has the neurological form. Clinical signs. With the neurological form, typically there's a degree of paralysis in the leg nerves, the wing nerves, or the neck nerves. Now what happens is the tissue, the nerve, is infiltrated with lymphocytes. So in the leg, it would be a swelling of the nerve, the ischiatic nerve. In the wing, it'd be the brachial nerve. In the neck, it could be in the nerves there as well. Most commonly, the leg paralysis is the form of the neurologic that's seen, followed by the wing and the neck. The nerves are swollen. They have what I refer to as a lumpy, bumpy texture on them. I know that's not very scientific. This can also the lymphocytes can also be deposited in the eye of the bird, in the iris, commonly referred to as gray eye. The colored ring in the eye will be discolored in one eye. Instead of being, say, that chestnut color orange, it's going to be that grayish color. Visceral form, you'll have tumors in the abdominal organs, such as the liver. Cutaneous form gets in the follicles where the feathers develop, and those feather follicles are enlarged. In other words, the skin has these lumps and bumps on it, and these are little tumors. Now, an infected bird has the virus lifelong. Diagnosis, signs and lesions, histopathology, for example, taking out one of those leg nerves, you look for the lymphocytes in the nerve tissue. Virus isolation, PCR tests are used, but they have limited sensitivity. And then serology. There are some serologic tests that can be done. There is no treatment for this one. Affected birds usually succumb to the disease fairly quickly. Prevention, vaccination. Now we use HVT, which is a strain, Rispens, SB1. The vaccine, since this is a worldwide disease that is everywhere and is picked up very, very early, we vaccinate in the egg at 18 days of incubation, in ovo vaccination, or day one. I've worked with poultry long enough that I can remember we did not have in ovo vaccination. So all the birds were vaccinated under the skin, subcutaneously, in the back of the neck at day one. It's important that it be given early. Nowadays, we can put it in the egg at 18 days of incubation. Here's some pictures of some birds with it. Here we have a broiler. You can see they're not using their wings. They can't walk. They've got a lot of dirt on them because they're doing what we refer to as wing walking. They're using those wings to push themselves along. Here is a backyard hobby chicken that's got it, and they're on their side. They just cannot walk. This is the leg paralysis. This one's the same thing. These are the neurological forms. Here you can see these little tumors right here in the liver. This would be a visceral form of it. Another viral disease, infectious bronchitis. Very common, and it's worldwide. Highly contagious. It too is it's a respiratory disease. It adversely affects egg production and affects bird performance. It's caused by a coronavirus, and there are multiple strains of this virus that cause the problem. Transmission, the virus is shed readily in the respiratory secretions and in the feces. The virus can be spread by airborne, contaminated feed, equipment, contaminated water. The incubation period on this one is short. I mentioned some of the others that the incubation period can be several days. This one's short, 24 to 48 hours, very, very quick. The severity of the disease is influenced by multiple factors, such as the age of the bird, the condition of the birds. Are they on good nutrition? Are they stressed? How warm are they kept? Lots of factors involved in that. Morbidity, or number of birds affected, can be as high as every one of them, 100%. Now, we see the infection in young birds as well as in adults. In the young birds, typically, the baby chicks, one of the hallmark signs that I've seen is they like to just cheep. They're huddling and they're cheeping a lot. They're going to be continually doing that. You may see a sneeze in them, a cough, some respiratory sounds, you get the rough air movement, and they're going to be depressed. Adult birds, such as adult layers, decrease in egg production, can be fairly sizable. Appetite's going to go down. The shells of the eggs will be thinned. The eggs can be abnormally shaped. We may have loss of eggshell color. In other words, a brown egg is more of a pale brown egg, or possibly even goes to white. Now, one thing you can see is watery egg contents, the egg albumin. Usually about 2 to 3 weeks after they've recovered from this, the egg albumin is more watery. Lesions, mildly swollen face, increase in mucus in the trachea, increase of that mucus in the sinuses, and there will be increase in all the nasal regions. Air sacculitis can be there. There are strains of this coronavirus that we refer to as nephropathogenic, which means they affect the kidneys as well. And what you'll see in those birds, you'll see swollen, pale kidneys, and they're going to be discolored. You'll see the urates, little white speckles in those kidneys. Diagnosis, signs and lesions, serologic testing such as the ELISA test, histopathology, isolation of the virus, and there are PCR tests. There are lots of tests available to diagnose this disease. There is no treatment. Again, just trying to keep the birds comfortable. Control and prevention, vaccination programs. Now, there are multiple strains of this. Many times you'll have to use several of them to vaccinate the birds. It's not uncommon to have 1 or 2 strains given in the egg, and then a different strain given when the birds hatch at day 1. And then again, good biosecurity to keep this out. Now, there's a similar respiratory disease that looks very, very similar to this one. It is what we refer to as the endemic strain of Newcastle. We do have a discussion on the virulent strain of Newcastle. The endemic strain of Newcastle gives very, very similar signs. Maybe see a little incoordination in some of those baby chicks from it, but it too is controlled by a vaccination program. In fact, in many of the vaccination programs, it will say on there that it's like NDV, Newcastle disease virus, and IB, infectious bronchitis. They're given together, Newcastle disease and bronchitis. And again, that is not the virulent strain of Newcastle. And then good biosecurity for it as well. Avian Pox, another viral disease, worldwide, can be of economic importance considerably. It's caused by an Avian Pox virus, which is a DNA virus, fairly large virus. This virus is a tough virus. It's resistant in the dried scabs, can be in the environment for a considerable period of time. The virus is shed from the lesions, and it spreads by direct contact to abrasions. It can be aerosolized, it can be ingested, and mosquitoes and other biting insects can mechanically transmit it. 2 forms of pox. Commonly referred to as dry pox, which is the skin form or cutaneous form, and then there's diphtheritic or wet pox. They look entirely different. You will see a decrease as far as clinical sign. You'll see a decrease in flock performance, a decrease in egg production when it's in layers, be they broiler breeders or commercial table egg chickens. Usually the mortality is fairly low, but when there can be secondary infections, as we see with wet pox, it can get up there. With dry pox, the lesion, varying degrees of this, you usually will see all three of these on it: nodules, ulcers, blisters, and dried scabs on the unfeathered areas of the skin. Now, all these stages can be found on these unfeathered areas. You can sometimes see this on the feet, the legs, these lesions, as well as sometimes in the areas that are feathered. With wet pox, it is a proliferative lesion. That's seen in the mouth, be at the corner of the beak. Sometimes we'll get it down, way down in the esophagus and even into the trachea. So a little different. This one is more blisters and dried scabs. This one is a huge proliferative lesion down in the throat. Here we have an example of it. Here's a chicken that's got some of these little lumps and bumps on the comb. And here, looking at this, we've got this down in the throat. With the wet pox, sometimes those lesions will get to the extent that the bird cannot eat or drink. Diagnosis, the lesions. You see those lesions, you can be pretty certain that it's pox. Histopathology can be used, and then we do have PCR tests. No treatment for this one either. Possibly on some of these birds that have some secondary infections, you might want to use some type of topical antibiotic, keep down the secondary infection, but usually just good care of the bird, that TLC again. Prevention, vaccination works wonders with this one to help prevent it. It's typically a lifelong immunity from one vaccination. Now, the vaccination period, most commonly it's somewhere in this period here around 8 to 12 weeks of age. The vaccine is given by the wing web method. On some birds it may be given in what's called a thigh stick, but there are a couple of 2 or 3 vaccines out there that can be used, and they all do a very good job. Mosquito control and flying insect control, since they can serve as mechanical vectors. Good sanitation. This kind of helps with mosquito control. You don't want little areas of standing water. And then again, biosecurity. Coli bacillosis. This is a bacterial disease. It is worldwide. Probably, many people say it is the most common bacterial disease, and it could very well be. But this can be a localized infection or a systemic infection. It can be secondary infection. As I mentioned with Mycoplasmas, we can have a secondary infection from E. coli in there. You can also see this as a secondary infection with outbreaks of these other diseases. Now, transmission, fecal oral, fecal respiratory. The bacteria is picked up. Incubation period varies. And the reason for the variance is it depends on which system is affected. We can see this as a skin infection. We can see it as a respiratory infection. We can see it as a systemic infection, a pneumonia, an infection of the intestinal tract. It's really variable as to what type of infection it is, dependent upon the system. Same thing with morbidity and mortality. The mortality can be extremely high or it can be fairly low. Signs depend on the system affected. Some birds, no signs whatsoever. They just die. There can be a coughing, that would be a respiratory infection. Diarrhea would be more in the GI tract. Poor production, poor growth, depressed, decreased appetite, weight loss, lameness. If it gets into the joints, we can have a joint infection. The birds will have varying degrees of lameness. Again, lesions are variable, depends upon the organ system affected. Commonly what we see is a fibrinous membrane or exudate on the surfaces of the organs when we have a systemic disease. The intestines will have hemorrhages, the organs will be swollen, we'll have pneumonia, joint infection, and skin lesion. And you will see that exudate in those skin lesions and in the joint. Diagnosis, looking at the lesions gives you a pretty good idea, and then isolating the bacteria. Fairly easy to isolate the bacteria. Treatment, approved antibiotics based upon antibiotic sensitivity. It is important to have an antibiotic sensitivity on this one to see what will work. Prevention, again, biosecurity, sanitation, good ventilation, and vaccination for other diseases. Here we have some lesions. Here's a bird that obviously doesn't feel very good. Here you can see the evidence of the diarrhea. Here you can see that exudate. It's a little bit here on the heart, on the the liver, and here it's much more extensive. Look at that heart right there. It's just sort of a yellowy white in coloration. And then we have that yellowy white gray, what I call it, on the liver. Now, my description of some of these lesions may be totally different from yours as far as color, because I do have a, as they describe it now, a color deficiency. Coccidiosis. This one is a protozoal disease, and it's seen in poultry. It is a major economic impact in the poultry industry, and it's caused by the protozoan, by one of the Eimeria species. There are 9 species that infect chickens. I've listed the ones that are most prevalent in the United States, which is the Cervulina, Maxima, Mitis, Necropsy, Brunetii, and Tonella. May be different in different countries. I'm sure it is. How is this one transmitted? What happens is the protozoan forms a sporulated oocyst. Think of it as kind of just an egg that's shed in the feces. A bird in the house picks up those infected feces on their feet, takes it in orally. So we can have contamination of the soil and litter in the poultry house. These oocysts can be carried into other houses, on your shoes, on equipment. This is why we like to keep shoes and keep those clean. Incubation period, about a week, roughly 4 to 7 days. Signs, decreased growth, anemia, if we have hemorrhages in there. Of course, the birds are depressed, ruffle feathers, dehydration. They're not going to want to eat, and variable mortality and morbidity. With a diarrhea, it can be just a very runny diarrhea, or it can even be bloody, depending on the species of Eimeria that's affecting these birds. Here is obviously a bird that doesn't feel good. Now, I learned a long time ago in veterinary school, many years ago now, over 40, we would refer to this as ADR, and I will share that with you now. That stands for ain't doing right. That's one of those Texas colloquial terms. So we'd call this chicken ADR. What are the lesions? Well, some degree of inflammation in the intestinal tract, an enteritis. There can be hemorrhages. Of course, the bird's going to be dehydrated because of those hemorrhages and water loss. There can be cecal cores. That's especially true with Eimeria tonella. And these will be dried, cheesy-like cores in the ceca. Now, these lesions vary depending on the Eimeria. Here we've got some slides. You can see these hemorrhages outside here. Here it's a little roughened, remember? And here look at the blood in those ceca. This would be tonella, almost always. This is a chart that shows that each species can affect a different area of the intestinal tract. For example, tonella, primarily the infection is in the ceca and the lower GI tract here. Praecox, the duodenal loop, upper GI. Necropsy, the middle. A Cervulina, the duodenal area. So it depends upon the species as to which area is affected. Diagnosis, you can get a really good idea of the diagnosis of coccidiosis by the gross lesions, obvious there in the intestinal tract. Easy to do a microscopic examination of the intestinal contents. Do a little smear using either a cover slip or a knife blade. Scrape the contents, the mucosal surface of the intestines. Put that on a glass slide and look at it underneath the microscope, looking for those oocysts. And in many of these Eimeria species, there will be plenty of them to look at. Histopathology, a microscopic examination of the intestinal tract, looking for some of the other early lesions can be done. And then molecular tests, such as a PCR test. There are ways to treat. If we have an outbreak, we can treat with anticoccidial medications. We also have a very strong need for new medications because we do see resistance to these. You may be on what's called a shuttle program of changing a coccidial medication in there for your birds. Depends on what the company does. Prevention, coccidiostats in the feed. These are routinely used. Good biosecurity. I mentioned earlier that these oocysts can be tracked around, so good biosecurity helps you. Vaccination. There are vaccines for coccidia that can be given. Good litter management. We don't want to have like wet spots in the poultry house litter that allows these coccidia to survive longer than that. And then again, research into continuing research into new products will help, hopefully. Poultry medications. I will make this comment on poultry medications. Unless the condition is in just a single bird, the entire flock usually has to be treated. Now, there's multiple methods of delivery for medications. They can be given intramuscular or subcutaneous. Those are both labor intensive. They can be given orally. That too is labor intensive. Or they can be given in the feed or the water. That's a little easier, but it has to be an approved medication. You always want to follow the directions on the label and make sure you follow the withdrawal time. Don't be tempted to change these directions, and follow those withdrawal times. Now, what is the withdrawal time? That's the time that's needed for animal products. They should not be consumed after the use of a medication. That's the time frame that you don't want to consume those. This time allows the medication to be metabolized in the animal and excreted down to where we have a safe, acceptable level in the tissues. It's very important that you follow that withdrawal time and you follow the directions for use of that medication. Now, a word on vaccinations. There are numerous vaccines out there available for many of the poultry diseases. They're very cost effective. Multiple methods of delivery. In ovo, these are given into the embryo at 18 days of incubation when those eggs are moved from the incubator to the hatcher. Basically, we say from the setter to the hatcher. There are spray vaccinations. A lot of times commercial poultry companies will spray the birds, what's called a spray vac, right after they're removed from the incubator. They're maybe sprayed when they're put in the boxes. Some vaccines are given subcutaneous. Some are given as an eye drop. Others are given, this one for example would be pox, by a wing web stab. Others are given in the drinking water. So multiple methods of delivery of the vaccines. Follow the recommendations on giving those. And a vaccine program, follow that vaccine program for your commercial company. Those are tailored for the diseases in the area and the strains of the viruses in the area. And typically the breeders are monitored to see what can be going on in there as far as their antibody level. But again, vaccinations are an important way, an important tool to use to prevent many of these diseases. Any of these diseases can be problematic. You want to prevent disease in your birds. No one wants disease in their birds. So it is important to follow the things that we've outlined as far as prevention, and it's important that you learn what a normal bird looks like and learn to recognize the early signs of illness so that you can get help in your birds before it becomes problematic.